I've had like one of the most stressful days in a very long time. So, my boyfriend had major surgery done today. He had his neck fused at his C4, 5, 5, 6, 6, 7, and then disc 3 completely replaced. And, as a chronic pain patient and having 5 neck surgeries myself, and then dealing with like CRPS, adhesive arachnoiditis, and many more health issues, like I was freaking out because I know the statistics are, especially for the cervical area, they're not as like, it's not as dangerous as like, your back area, regular back area, but I know what could be, like if this didn't work out well, if it was a failed neck surgery, and then the other part is, would they treat him properly after he had surgery concerning like his pain, and like would when he goes home, will he get the medications he needs as well? I'm in North Carolina, and if you have surgery, they give you up to 7 days of pain meds afterwards. And if it's for like acute pain, like out of hospital issues, it's 5 days. And then afterwards, they have to go to a pain management doctor. I think he'll be okay by then, fingers crossed. Today he had quite the issue because he had his second shift nurse. She got really busy, and they had him already on Tylenol and Celebrex all day. Like after surgery, he got out. So he went in for surgery at 9 this morning, didn't get out till 2:30. They gave him Tylenol and Celebrex all the way till 7:30 tonight. And then finally they started giving him IV pain meds, which I had to like push for. And so, I think their reasoning is they're trying to release him by tomorrow. But because of where he is at currently, I think they're going to kind of keep him again. But, I'm thankful. I've been staying here with him all night. It's like 1:30 in the morning. I'm dead tired, but there's no way that I'd leave him, because just going through this myself, and many times I was on my own. You need an advocate, because you just don't know, like, if you need somebody to be there for you and stand up for you. And he's needed that several times today so far. But I'm really glad I could be there and like kind of give back for once about this, because like I just remember going through this. I was so scared. I felt so alone. I felt misunderstood. I felt like am I asking for something that's wrong or bad here? And no, I mean, there's nothing wrong after a major surgery needing something to take the edge off, because I mean, like, literally within 20 to 30 minutes, like, he'll fall asleep a little bit and he wakes up like sometimes yelling in pain, because that's how much it hurts. That's not right. Like, why are we in today's age, why are we making people suffer, or like make them feel crappy for not being able to tough through it? This is not about toughing it out. This is about being able to heal properly and letting your body have the chance to breathe a little bit and to get better. I don't see anything wrong with putting like a limit on how long pain medications a surgeon could prescribe, like 7 days. Like, I think that's kind of adequate, and then afterwards you have to go to pain management. I get it. They don't want to get in trouble, or have any issues. So, they're wanting to be protected. So I get that. But what's not right is not giving any pain medications at all to patients after major surgery. I'm hearing so many people go through surgeries and waking up and like they're giving IV Tylenol. Like, what is wrong with this world that you're going to give somebody that just had like hip surgery IV Tylenol afterwards? That's just ridiculous. And that's why, as a chronic pain patient, it's so important, at least for me, that I fight. I can't stop until every person receives proper care. And because we're not in a third world country, are we? We better not be. Although it seems like sometimes we're turning into that. Anyway, I'm just like so freaking relieved because he woke up and he could talk. He didn't have any heart issues. And you know what the first thing he said to me? Janelle, my hands and my arms, I could feel them. I wanted to cry. We were in a really bad car accident like 3 years ago, and it's been hell for him ever since. And they wanted him to get surgery then, but he was hoping he could, get through it and not have to do it. But this last year and a half has gotten really bad for him. And I felt terrible because I told him, I know you can't see it, but like you're slowly getting worse and worse. And like he was having problems with anxiety, controlling like temper, mood, all that stuff, because when your body is put under constant amounts of pain and inflammation and stress, it's hard to do that, I mean, it will slowly eat you up. And if there's a way so you don't have to be that way, doesn't a patient deserve that? I think they do. Anyway, thank the Lord that he's awake and he's doing well, and I just hope he continues to heal, has no issues at the site where he got the surgery, and gosh, I think he's gonna get his life back. I'm just so thankful for that. I hope everybody's having a good night.